like traveling by myself. It takes you out of your usual zone, and then you find out things about yourself you would never have found out if you were just sitting at home talking to your cats.
It was like a eat, pray, love. But yeah, and then through that you get to find yourself and grow.
This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
I'm Dr. Freddy Gomez, and this is Medtalk. In most circumstances, our body is exposed to numerous factors that may pose a threat to our health. Threats that many of us may not be totally aware of. We tend to focus on other organs of the body such as the heart, the brain, lungs, whenever healthcare is brought to our attention. We tend to take for granted a part of our body which for most of us is the first thing we use when we wake up and the last thing we use before we go to sleep. That is our eyes. The World Health Organization says that 80% of the causes for visual impairment are actually preventable and treatable. Yet a large majority of the population does not include eye care amongst their health priorities. In 2014, an estimated 285 million people had some form of visual impairment, and of which 39 million were blind. Some of the major causes of visual impairment include uncorrected errors of refraction, untreated cataracts, and glaucoma. How vital is it to take care of our eyes? And what are some things that can cause harm to our eyes in our everyday activities? Joining us is Dr. David Hornfield and Dr. JP Ramos. Both are optometrists and professional service managers from Vision Express. Welcome to the show, Doctor.
Hi, good evening.
Do you think that the typical individual takes their eyes for granted? Let's start with Dr. Dave.
Yes, they do. The problem is that if they don't feel anything is wrong with their eyes, or even if they can see, you never know what's wrong.
I cannot emphasize enough the importance of having your vision tested on a day, or not on a daily basis, but on a regular basis.
Okay. Now, what do you think are some of the activities that Filipinos do on a daily basis that cause or may cause harm to one's eyes, but they're not really aware of it?
There's two really environmental factors that we have found in the last couple of years that are important. One of them is the ultraviolet radiation from the sun, and even on a cloudy day. And the second is high energy violet rays, part of the visual spectrum, in which the LEDs, the cell phones, computers, and laptops are emitting.
Okay. Now, Dr. JP, so what Dr. Dave said, these probably encompass like the UV rays, Philippines being a tropical country,
Yes.
Especially now, a lot of people are involved in sports. Are they in particular at risk of damaging their eyes?
Of course, just like everybody else. I mean, we are in a tropical country, just like what you said. So, like right now, we are taking care of our skins, right? Against UV, against IRs or infrareds. It's equally important, or as equally important, to protect our eyes also against UV. Sometimes we see sunglasses as like a regular fashion trend, but it has a purpose, which is actually to protect our eyes.
Yeah, now, is having one's eye tested sort of a lengthy process? Does this cost a lot, do you think, for the average Filipino?
Not really. I mean, we have a lot of optical clinics available to our to all of us. So it's just a matter of you personally going to an optical clinic and have a consult or a talk with your doctor, and we can go on from there, give the proper advice.
Now, how about investing in eye care? Why do you think is it important that the Filipino should invest in eye care?
The reason is because they really don't know what's really happening with their eyes. As JP will tell you, it's at least 80% of our senses.
80% of like of all the other senses, 80% of the information coming through is like through our eyes. We cannot emphasize enough the importance of of our eyes. We only have one pair, so we should like take care of it.
Okay. Now, you mentioned earlier, Doctor, that one should be aware of the UV rays of the sun. Can a lower-end pair of sunglasses with UV protection be the same as those as the higher-priced ones?
Not really. The lower price will take away the intensity of the light, but that is different than the ultraviolet radiation of the light.
Okay.
Well, what's important here is that the integrity also behind the manufacturer of those sunglasses. I mean, not for anything, but if you buy your sunglasses like somewhere else, like cheap markets, you're not sure if you're buying the right quality lenses that will be able to protect your eyes. At least with those high-end markets, you're assured, you're guaranteed that you're getting the correct ones. That's one of the promises there.
All right, yeah, and I agree with that. Now, let's talk about contact lenses. Can contact lenses just be as effective as wearing glasses? Because I hear sometimes that they say contact lenses in the long run might cause more harm to your eyes than good. Would you agree with this, Doctor?
Well, nowadays they do have contact lenses with UV filters.
Yeah, of course.
The problem is that people do not throw them away when the time comes to throw them away. If they are a monthly lens or a daily lens, you have to throw them away and listen to the doctor who is fitting you.
Okay. What about hard contact lenses? Do you still advise people to have contact if they still exist?
Yeah, they still exist. There are still some segment of like the population that still uses or utilizes hard contact lenses, but it's not as popular anymore compared to like maybe 10 years, 15 years
That's
ago.
right.
Okay. All right. Do you have any other advice, Doctor, for our audience out there with regards to eye care?
Just get your eyes tested every year, because you never know what's wrong or what's right with your eyes.
Okay. Dr. JP?
Yeah, the same thing. I cannot emphasize enough how important it is to take care of our eyes. So a regular visit to an eye doctor is very critical and mandatory, I think, for everybody.
Okay, very well said. And with that, we'd like to thank Dr. David Hornfield and Dr. JP Ramos. Are you feeling pressure in your eyes and having blurred vision? You might want to know the symptoms of people suffering from glaucoma. Let's talk more about it when we return.
Sa simula ng ubo, agapan ng Asco Forte Menthol Syrup.
May gagaling pa ba sa Petron Value Card? I just gas up and I get more Petron Peso points.
I can even get discounts for engine oils or exchange my points for miles.
I get automatic bonus points on my birthday.
Parking? Ang dali!
My shopping discounts pa for me.
Ang galing, di ba? I get these and more all year round with my Petron Value Card because Petron knows we deserve only the best.
Nakikita niyo naman na ang ganda ng heritage natin. Itong ginawa natin sa Las Casas ay para maintindihan natin na maganda ang ating pinanggalingan. At maintindihan natin na bawat isa sa atin ay may pride sa ating heritage.
And it's a way of showing that we have preserved all of these churches through photographs. And it's perfect because we are in a place called Las Casas, which has all of these houses that have been preserved.
Para to sa bayan natin, sa Pilipinas, para paalam at paintindi sa kanila na maganda pala ang pinanggalingan ng Pilipinas.
crush, vow, date. What is the story behind these stories?
All great ads are actually truths well told. Storytelling, that's another thing. But it starts with a powerful truth, or in marketing term, we call it insights. In common term, we call it hugot. At maraming pwedeng hugot mong pwedeng kunin. It's choosing which one will fit your objective and will fit the story that you want.
What are you doing on March 14th?
What are you doing on March 14th? What are you doing on March 14th?
What are you doing on March 14th? What are you doing on March 14th?
I want to share my own special cacao recipe with a very special group of people. We add our unique ingredient, the tablea from Santa Maria, which will make our braising adobo a little bit thicker and a little bit richer. Kain na tayo!
Every Filipino is a freedom lover. I strongly want to hope and believe that's what is in their heart.
Akala ko talagang mahirap. Akala ko hindi ko kakayanin. Pero kaya ko rin pala.
It's a choice between believing material things or God. So I choose to believe in my God.
Sa mga kabataang Filipino, huwag po nilang isantabi yung mga pangarap nila.
Matunay na Filipino, kaya niya maging patriotic. Kaya niyang maging proudly mabuhay kung ano yung nasa dugo niya.
Get your morning sports fix with me, Andre Felix, weekdays at 11 a.m.
And me, Nico Halili, weeknights, 7 p.m. and 10 p.m. on Sports Desk. Only here on CNN Philippines.
We kick off our Women's Month series with Senator Lauren Legarda, an advocate of women's rights, indigenous people and culture, and the environment.
What is my dream for our country? For us to be living in a sustainable, resilient country. I'd like to see our women given the opportunity for livelihood. I'd like to help more women in whatever field they want to excel.
Tell me about your relationship with President Duterte.
Nung umpisa, he was uncomfortable if I called him Sir, Boss, Mr. President.
Or an affairs secretary coming up. You feel, oh my God, this is going to be a different way.
I'm very optimistic.
Let's play a short question and answer. Yes or no? Gay marriage? No. Divorce? No. PJK? No. FOI?
Yes.
This must be hard for you to just answer yes or no.
Yeah. Very.
Meron na pa po bang ibang naikwento sa inyo si Dayan?
Ang pinaka-importante doon yung kanya sinabi tungkol sa magtanggap ng pera.
Mula kay Kerwin, sir?
Mula kay Kerwin, yeah.
Did you know that in the Philippines, some 3.5 million Filipinos are suffering from glaucoma, and the disease is now the leading cause of non-reversible blindness? Second only to cataracts, glaucoma is still one of the major causes of blindness among Filipinos. What makes it a major concern for the health of a person's eyes? To answer this question, here with us is Dr. Benjamin Abela. He's the president of the Philippine Glaucoma Society, and he's also the president and CEO of Philippine Glaucoma Foundation. Welcome to the show, Doctor.
Thank you, Freddie.
Now, Doctor, what is the incidence rate of glaucoma worldwide?
Well, let me just start off first by saying that there are basically two types of glaucoma, the open angle type and the angle closure type. Worldwide, in 2010, it was estimated that there were about 60.5 million people in the world with glaucoma. And the starting figure there is that 59% of this worldwide cases of glaucoma are women. About 50% of worldwide glaucoma is found in Asia. And here in Asia, more than 80% of our cases are angle closure types. In the Philippines, we estimate maybe about 3.5 million, but it's probably an underestimation because of problems with recording and problems with people who probably are not aware that they have this particular disease.
Okay, so those numbers are definitely significant, doctor. So I guess the next question is, could you explain to us what exactly is glaucoma?
Okay, to put it in the medical terminology, glaucoma is basically an increase in pressure in your eye that affects your optic nerve. To put it for people who are not medically inclined, I would probably like to explain glaucoma by likening it to maybe a kitchen sink, where you have a faucet and the faucet is open, you have water coming into the sink, and of course you have a drain that drains out the water. If the amount of water coming in is equivalent to the amount of water coming out, then the water is level. But imagine if you cook and you start to put food inside the sink, you will essentially block the drainage. But your water is still coming in, and therefore volume increases, and in a closed area, just like the eye, pressure will also increase. As your pressure increases, the hole in the middle gets bigger and bigger and bigger. When it gets to the size of that 1 peso, you are totally blind.
Now, how different is glaucoma from cataracts?
Now, when you talk about the anatomy, the cataract is really a lens problem, which is behind the iris. But glaucoma is really high pressure in the eye that causes a problem and destruction of your optic nerve.
Okay. Now, do we already know the cause for glaucoma?
We don't really know the cause of glaucoma. All we know is that it is the leading cause of non-reversible blindness in the world. And the only treatment that we can give for glaucoma is to treat the pressure.
Now, I guess what's important for the people to know is what are the symptoms? Anong nararamdaman ng isang taong may glaucoma?
Now, when you take the open angle type and the angle closure type, the open angle type is very insidious, meaning that it will cause harm and you're not aware that it's actually happening. People can actually come to us and we see that almost they almost have tunnel vision, and they probably have only 10% vision left. And that's when they realize that they actually have glaucoma. That's the painful type of glaucoma.
Okay. Now, when someone goes to your clinic, doctor, and inquires about glaucoma, how is glaucoma diagnosed naman?
Well, the glaucoma screening is very, very simple. When they go to our clinic, we usually have a visual acuity test, so we test their vision. And then we take their pressure by using the applanation tonometer, as you're probably familiar with also. And we check the angle of the eye by using a special lens. It's called a goniotomy. The procedure is called goniotomy. And then optic nerve is also observed through the slit lamp and through what we call indirect biomicroscopy or fundoscopy, indirect fundoscopy.
Okay. So basically, like what you said, the screening process is fairly quick. So anyone doesn't really have to invest that much time or effort to have their eyes checked for glaucoma.
That's right. If we do have, however, a suspicion that there is something wrong with your eye, like in gonioscopy, we find that your angle is a little bit narrow, or in fundoscopy, we find that your optic nerve is a little bit bigger than that 30 centavo hole that I mentioned earlier. Then we send the patient to have more tests on glaucoma, like the visual field test, the perimetry test, and the optical coherence tomography tests to take a picture of the optic nerve.
Can we prevent glaucoma from happening? And perhaps the most important question is, what are the treatment options available for glaucoma? Let's find out when we return. Keep it here on Medtalk, only on CNN Philippines.
Crush, vow, date. What is the story behind these stories?
All great ads are actually truths well told. Storytelling, that's another thing. But it starts with a powerful truth, or in marketing term, we call it insights. In common term, we call it hugot. At maraming pwedeng hugot mong pwedeng kunin. It's choosing which one will fit your objective and will fit the story that you want.
Get your morning sports fix with me, Andre Felix, weekdays at 11 a.m.
And me, Nico Halili, weeknights, 7 p.m. and 10 p.m. on Sports Desk. Only here on CNN Philippines.
We kick off our Women's Month series with Senator Lauren Legarda, an advocate of women's rights, indigenous people and culture, and the environment.
What is my dream for our country? For us to be living in a sustainable, resilient country. I'd like to see our women given the opportunity for livelihood. I'd like to help more women in whatever field they want to excel.
What are you doing on March 14th?
What are you doing on March 14th?
What are you doing on March 14th?
Tell me about your relationship with President Duterte.
Nung umpisa, he was uncomfortable if I called him Sir, Boss, Mr. President.
Foreign Affairs Secretary coming up. You feel, oh my God, this is going to be a different way.
I'm very optimistic.
Let's play a short question and answer. Yes or no? Gay marriage. No. Divorce. No. EJK. No. FOI.
Yeah.
This must be hard for you to just answer this.
Yeah. Very.
I want to share my own special cacao recipe with a very special group of people. We add our unique ingredient, the tablea from Santa Maria, which will make our braising adobo a little bit thicker and a little bit richer. Kain na tayo!
Anything you do in traffic will have a ripple effect. Look at that sign there that just says no parking, and then you got this truck parked there. You can sort of see where the entrapment is happening here. There's just so many choke points. This is a dedicated no loading and unloading zone, and you'll see a jeepney parked right there. You see, once you break the rules for one, you may as well break the rules for all. This is what an average motorist has to encounter day in, day out. There are ways that we can solve it, but most of that comes from within.
Every Filipino is a freedom lover. I strongly want to hope and believe that's what is in their heart.
Akala ko talagang mahirap. Akala ko hindi ko kakayanin. Pero kaya ko rin pala.
It's a choice between believing material things or God. So I choose to believe in my God.
Sa mga kabataang Filipino, huwag po nilang isantabi yung mga pangarap nila.
Mga tunay na Pilipino, kaya niya maging patriotic. Kaya niyang maging proudly mabuhay kung ano yung nasa dugo niya.
Sa newsroom ngayon, makikita nyo pa rin yung nakagisdan nyo na kalidad ng pagbabalita sa CNN Philippines. Ito ay para sa inyong mga Pilipino. Mula Lunes hanggang Biyernes, alas 10 ng umaga, ang newsroom ngayon ay hindi lang tungkol sa paghahatid namin ng balita, kundi kasali rin kayo sa aming talakayan. Kung ano yung mga komentaryo nyo, reaksyon nyo sa iba't ibang issue na kayo rin ang magsasabi sa amin kung makabuluhan ba sa inyo o napapanahon at kung gusto nyong talakayin pa ng mas malalim. The Duterte administration has claimed success in the war against drugs. Experts contend a different story when the drug problem is viewed as a health issue.
Here are some myths and facts when we talk about glaucoma. First, while older people are at a higher risk of developing open-angle glaucoma, this eye disease predominantly affects people age 40 and above. Second, individuals with perfect vision can still have or develop glaucoma, since the disease usually affects peripheral vision first and central vision later. And lastly, glaucoma can progress or change without warning, and therefore patients should always be aware of their present condition. and this is done with regular visits to your ophthalmologist. Welcome back to Medtalk, and still with us is Dr. Benjamin Abella. Now, doctor, how can glaucoma lead to blindness?
Well, basically through the destruction of your optic nerve, because your optic nerve is your connection to your brain, and the fibers that are usually lost as a result of increase in pressure will eventually lead to visual field blindness. I have here something to show that the progression of your blindness can lead to something wherein you have constricting visual fields, eventually affecting the central vision and getting larger and larger to the point that you can have this kind of vision, having central island or even temporal island vision. And mind you, Freddie, that this kind of vision is not reversible. Once you lose this vision, you cannot bring it back. We can only try to preserve whatever vision you have left.
So I guess we can't stress it enough. When should a person seek consult for glaucoma?
If a person has risk factors for developing glaucoma, then they are 2 to 3 times at risk of developing the disease. If you have a family member or family history of having glaucoma, then you have 10 times at risk of developing the disease.
Are there some risk factors that a person can control?
Yes. The other risk factors that I forgot to mention are diabetes and hypertension. And of course, controlling these two will also decrease your risk for developing the disease. We mentioned age as also a risk factor. Sometimes patients with very high myopia later on in life can also develop glaucomatous optic neuropathy.
Okay. Now that we know about some of the risk factors, let's talk about the treatment, doctor. What are some of the treatment options available for someone with glaucoma?
Now, the rule of thumb is that when you have open-angle glaucoma, you should treat it medically. And if you have angle closure, surgical is the way to go for that kind of illness. For the open-angle types or for the medical type, there are eye drops that we can prescribe. The surgical approach is basically you have to determine the mechanism by which the angle was closed in the first place, and they can be treated with laser treatment, some with trabeculectomy or glaucoma surgery, and some with just simply removing an intumescent lens or a lens that has become cataractous and big. You just simply remove, and that might even relieve you of the blockage of the angle.
What are the best ways that a person can do to prevent glaucoma?
Glaucoma cannot be prevented, especially if you have family history, I think.
Right.
But there are risk factors that you can control, like diabetes and hypertension. It's important that they have themselves at least screened if they have history, and to make sure that if they do have the disease, to continue to see their ophthalmologist so that they don't go blind in their lifetime.
Okay. Now, just quickly, doctor, just so people have an idea on how much screening for glaucoma costs. Do you have any figures? Is this covered by insurance?
Yes. Well, I'm glad you mentioned the free screening. We are celebrating from March 12 to 18 the World Glaucoma Week. And in several of the major hospitals, we will actually conduct glaucoma lay forum for the public, and that usually comes with a free glaucoma screening for the participants. As far as the cost for the private sector, it's usually
probably
just a regular checkup, probably within the range of about 800 to 1,000 pesos per checkup. That's about the range that you will find for glaucoma screening.
Okay, very well said. And with that, I hope people will get something, at least gain the knowledge and the importance of having yourself screened for glaucoma.
That's right.
All right, and thank you again, Dr. Benjamin Abella, for joining us tonight here on Medtalk. Join us again next week for more discussions about your health. I'm Dr. Freddy Gomez, and thank you for watching.
This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Tonight on Sports Desk, San Miguel and Barangay Ginebra gear up for Game 4 of the PBA Philippine Cup Finals. Then, we'll analyze the impact of Kevin Durant's injury on the Golden State Warriors. Find out how basketball strengthens the bond between Javi and Juan Gomez de Liaño of the UP Fighting Maroons. And later in the show, we'll take a closer look at the most lethal attackers in UAAP women's volleyball. Good evening, I'm Nico Halili, and this is Sports Desk.